I'm Adam Searing.
And I'm Adam Linker, and we're from the NC Justice Center's Health Access Coalition.
Well, last week in the General Assembly, they were having a good time. It was opening day.
Well, things were a lot more somber yesterday when legislators heard about the billion-plus shortfall in the state health plan that we're facing over the next 2 years.
That sounds serious. To find out what the problem is, let's go to Mark Trogdon. He's the head staff member for the North Carolina General Assembly, and he was reporting to a committee of General Assembly members yesterday about the shortfall in the state health plan and what to do about it.
Just under my professional view, if the benefits had been a little less richer and the premiums a little bit higher, you wouldn't be the problem you would be facing would be the normal growth in the health plan that you face every 2 years.
I don't think the problem with the state health plan is that it's too generous.
That's right. My wife is a state employee, and I can tell you those benefits and cost sharing aren't anything to write home about. So what's the real problem?
Well, straight answers are hard to come by, but we need to be looking at the administrator of the contract.
And what company is that?
That is the largest individual insurer in North Carolina, Blue Cross and Blue Shield. Now, we pay them millions to administer the state health plan, so we need to take a look at those administrative contracts and see if we're overpaying them or if we're wasting any money.
Let's see what happened yesterday when legislators asked about Blue Cross.
If you look at the claims processing administration contracts, I don't know what you'll find now. I haven't seen them, but they are subject to confidentiality. They're a non-public record. There's only certain individuals and one committee person that can have access to them.
That's right. Those administrative contracts are confidential.
Well, there was almost no discussion yesterday about Blue Cross and Blue Shield's role in this whole crisis.
This is such a big crisis. Blue Cross is making millions of dollars in profit in this state. They are heavily involved with the state health plan. I cannot believe we're not looking at Blue Cross's role in all this, instead of just talking about balancing this problem on the backs of state employees with higher cost sharing and benefit cuts.
So what are they going to do next? Well, let's turn to Representative Mickey Michaud of Durham
and see what he has to say.
We don't know what they're going to recommend, and that's why I say within the next couple of weeks we ought to have some information to give you.
So basically, we don't know what legislators are going to do. But what we do know is legislators are not asking the kind of hard questions they need to be asking to get to the bottom of this problem and find a solution. I'm Adam Searing.
And I'm Adam Linker.
And we're with the Health Access Coalition.